Good evening, everyone. My name is Ashton Mara. I am the executive editor of 100 Days in Appalachia, and I just want to thank you all for taking the time to join us this evening for our conversation about community journalism, about addiction, and about stigma. I'm also an assistant professor in the Reed College of Media at West Virginia University. So for my colleagues in journalism education, I'm just really grateful that you're participating in this conversation with us tonight. So we're going to be joined here shortly by 4 members of our community for this discussion, which you can see on your screen. But before we ask them to introduce themselves, I want to note for you that this conversation is part of the launch of a project of 100 Days in Appalachia and the Opioid Policy Institute. And it's also our recognition of National Recovery Month, which is commemorated in September. So I want to start now by inviting our lead partner in this project, Dr. Jonathan Stoltman, to introduce himself to you and also tell you a little bit about reporting on addiction. Jonathan?
Sure, great. Thank you. Ashton, it's been so awesome working with you and Kristen on this project. We're really excited, and I know nobody's here to hear me talk, but I'll do a quick background of the project and kind of how we got here, and then we'll launch into a discussion. So our journey's been a kind of a long one. We started talking about this in summer of 2020, and we've done 3 different focus groups with experts from across the country and a really nice diverse group. In February of 2021, we met with some academic experts, so addiction scientists, stigma researchers, treatment providers, and had a series of discussions about, what are some of the problems that they've identified with the media and how it covers addiction. Then we also met with community members, so another awesome panel of people with lived experience, peer recovery coaches, activists, harm reduction activists, and a federal judge with drug court experience. And again, talking about their perspective of both being interviewed as members of the community and then kind of what they're seeing with some of the narratives and some of the problems. And then we met broadly with the media, and we met with people with local media experience all the way to national folks from ABC and CNN, some freelancers, and we were really blessed to have 2 Pulitzer Prize winners that had Pulitzer Prizes for directly their coverage on addiction. And so, taking all of their feedback and all of their comments, we've been able to really shape this project to be what it is today. What we've identified from those discussions is a couple problem statements. So one is that very few people have access to evidence-based addiction treatment. And I imagine most people on the call would know that. And this is really even more true, unfortunately, for historically excluded individuals and people who live in rural parts of the country. And what we learned from those discussions and kind of the nexus of this project was that those barriers are often the result of stigma associated with addiction, incarceration, minority status, economics, and gender, and how the media covers those intersections when they talk about addiction. So what we figured out was there's a pretty clear solution for our group, and what we want to do is really target journalists. And journalists are really important. They're trusted voices in the community. They're really influential. An intersection of addiction crosses a number of different domains of news coverage, including health, science, but it also covers crime. And then for some reason, it always shows up in the style section. And so we really want to do what we can to work with journalists that cover those different beats to improve their coverage. And so what we want to target is both newsrooms and journalism schools. Newsrooms, as the journalists on this call know, are really pulled in a number of different directions. But at the end of the day, as we'll talk about today, they really want to make a positive impact in their community, and they don't want to do harm through their reporting. So we think by working with them to help them understand how some of the things and stories and narratives that they're using can be harmful, we hope we can see some change. And then the second prong is by working with journalism schools, who we all know are the future of journalism, but they also are most likely to land in some of these local and community newsrooms. And currently there's no training about addiction in newsrooms or in journalism schools currently. So what we really want to do is break that cycle. And so our approach is really based on the principles of calling in rather than calling out. So if individuals on this call, for example, see problematic reporting, we of course encourage you to report it to our website, and we'll do what we can behind the scenes to work with those newsrooms. And so how we're going to work with those newsrooms is with trainings, with our toolkits. And another really exciting part is our database of experts, which I think we already have 50 some experts from across the country that have signed up, that are either researchers, treatment providers, all people with a wide range of experience and a depth of experience. And so though we're going to make them available to newsrooms so that you'll start to see more informed reporting And then additionally, targeting the journalism schools with our curriculum that'll be solution focused and then person centered. And this is going to be off the shelf curriculum that any journalism school can integrate into a variety of different courses. And we're going to also provide training the trainer because we know that these are complex topics and we want to make sure that they're delivered in the right way to students. Our outcomes are varied, but as you can tell by focusing on journalism, we're really hoping that the individuals that use these resources can leverage them, and we can see improvements across reporting across beats. And so hopefully also discussing the complicated nature of addiction, it being a disease and it's progressive, and that there's a lot of different roads to treatment and recovery, which again, we'll talk about a little bit here today. And that ultimately reporting focuses on empathic reporting that talks about people with a substance use disorder as people first, and that doesn't do harm to them or to their stories. And that there's a limited amount of the stigma language that we're seeing and that have been identified by the research as really problematic towards individuals in treatment or seeking recovery. And then also news that really talks about the many barriers to treatment and during recovery. And lastly, and one of the most important things that we're working on is that letting people know that read the news, that see the media that covers addiction, that recovery is possible and that help is available. And so we developed 2 really simple story tags that I would be remiss if I didn't show them, of course, to this audience. And these story tags focus on that idea that, of course, recovery is possible and that there are these 2 resources that are national resources, this confidential hotline and this findtreatment.gov that's been developed by SAMHSA, that are really great places to start. And at the end of the day, we hope that reporting can at least include these resources so anyone reading those stories knows that they're not alone and that there is recovery that's available for them. We've also developed a Spanish language version of this and a Spanish language guide that's really exciting too. So I included that here as well. And I will pass it back over to Ashton.
I just want to reinforce really quickly, take the second to say that I think that final statement is really important, and we hope that you all will consider using that resource, because journalists are not treatment providers, but a lot of times our sources press us for help, right? And we are empathetic people. We want to help them. So the best thing that we can do is send them to the people who know what they are talking about. That's not necessarily a journalist. So we hope that if you do nothing else from this conversation, you will consider using that statement, and it's available on our website, easy to find, and you can always reach out to any of us to help you find those resources additionally. So now we're going to invite our panelists to turn on their cameras and join us for this conversation. I'm actually going to let each of them introduce themselves to you, but I'm going to ask our panelists to keep it as brief as possible so we can save as much time for our discussion and for our questions. I'm actually going to ask Abby if she will introduce herself first, because in the middle of the promotion for our event this evening, Abby started a new kind of a shift in her job and got a new title. So why don't you go ahead and go first?
Yes, my name is Abby Spears, and I'm a harm reductionist, a grant writer, community organizer, and also do outreach and policy work on both the local and state level around harm reduction and syringe service programs. And so, yes, there have been some small changes, but things are good. And I'm very excited to be here with the amazing panel of individuals tonight.
Well, thank you very much. Katie, do you want to go next?
Hi, my name is Katie Coyne. I am the public health reporter at the Charles State Gazette-Mail, and I cover, the last year has been COVID and nothing but COVID, but underneath that, there's an HIV epidemic that's coming up in our state, and before that, a lot of really heart-wrenching stories about recovery and addiction and the way it shapes our state and its systems.
And Dr. Blanco, can I ask you to go next?
Sure. So I'm Carlos Blanco. I'm a psychiatrist by training, and I work at the National Institute on Drug Abuse. What we do there is develop new treatments and better treatments for addiction. So that's what we do.
Thank you. And finally, Laura.
I'm Laura Lander. I'm social work faculty in the Department of Behavioral Medicine and Psychiatry at WVU. And I initially worked as a clinician starting in the early 90s in the field of addictions, and currently also continue to do clinical work as well as teaching and research in the area of addiction.
So as we get ready to jump into our first question, I just want to remind folks that there is a Q&A box at the bottom of your screen. As we have this conversation, we want to make sure that you all are involved. So please drop your questions into that Q&A box, and we're going to save some time at the end of this conversation to make sure that they get answered. Jonathan, I'm going to pass it off to you to start the questions.
Sure. Thank you, Ashton, and thanks for that great introduction. I'm going to start with asking Laura a question, and then we'll open it up to the rest of the group. And Laura, of course, knows that a lot of my focus on this came from working with Laura to try to improve some of the media coverage locally. So Laura, what do you think are some of the things that you commonly see in the news that has made your work harder? And also, what have you seen in the news that's increased stigma towards addiction?
So one of the populations I work with specifically are pregnant women with substance use disorders. And so this is a very highly stigmatized group of individuals. And one of the things that I cringe at when I see it is the term addicted baby or NAS baby. NAS stands for neonatal abstinence syndrome. And when we think about, what's stigmatizing, it's basically turning people into objects as opposed to using person first language. And so whenever we talk about individuals with addiction, we start with the individual or we start with the baby. So a baby has withdrawal or a baby has neonatal abstinence syndrome. A baby is not addicted. In fact, that's kind of clinically inaccurate, not to mention stigmatizing. And I have seen that over the years in like national media and wherever I go and talk to the media, if it has anything to do with pregnant women or babies, I will plug for person first language, including when talking about a fetus or a newborn. And, I think it perpetuates that these babies are bad or damaged or kind of unsavable in some way because they are not a person first, they are the disorder first versus being a person first. And so that's how I think it really perpetuates the stigma.
Thank you, Laura. That's awesome. So Abby and Carlos, I'll open it up to you too as well. Has there been anything that you've seen in the news that's related to stigma that's made your work harder?
I would say definitely. To just kind of echo what Laura was saying, I mean, working in harm reduction means that, we encounter individuals, in varying states of substance use, as well as, varying states as far as their life goes. We work with pregnant women, we work with single parents, we work with individuals that work every day, we work with folks that are unhoused. Like, I think that for one thing, there is a very common misperception or misconception about what the representation is of an individual that is potentially using substances. Also, too, there is very much a stereotypical view that is created of a person that uses substances. As I said, I, run a syringe service program, and, we provide syringes to folks that work every single day. They have parents that they take care of, they have children that they take care of, and they're loving parents, they're good parents, they're good caretakers of the folks in their lives. And unfortunately, what is often represented, especially in the media at large, is that somehow, because addiction is often represented as a moral deficiency instead of a medical condition, all of those things are somehow then abdicated because a person uses substances. And this inevitably means that, people fear reaching out, to talk again about what Laura said, how many women don't seek medical care because of the fear that they have around potentially using substances, whether that's even also Suboxone or methadone, while being pregnant. Like, we put a huge amount of risk into the lives of people because of the way that they're presented and because of the perception that people have of them.
So I mean, the first thing I want to say is I'm very grateful to you for organizing this event, and and my experience in I mean, my experience for many years in dealing with the press has been very positive. I think that the press in general, at least the press that contacts me, maybe I'm very lucky, been very good and very interested in understanding things. And over the years, I think also the coverage has improved. But I also agree with you that there are areas in which we could improve. One of them, which has been already mentioned by Laura and Abby, is the criminalization of substance use and substance use treatment. Of course, very few people want to associate with criminals, except probably other criminals. So to the extent that we think about substance use as a criminal behavior as opposed to a medical disease, a medical disorder, that's going to already create negative feelings in most readers or in most people that we have contact with. So to the extent that the media can educate readers that this is a medical disorder, not very different from diabetes or hypertension, I think that would be a great help. I happen to like sweets, and I cannot imagine if I lived in a society where sweets were forbidden, and then I had to like eat sweets, and I was arrested because I ate a bar of chocolate or something like that. I mean, and so I don't want to trivialize substance use, but I think we have to again move from thinking that, or people who have hypertension, if sometimes they eat salt and then they have high blood pressure, we never think about putting these people into jail because they ate salty food, right? So I think that would be an important issue. The second aspect that again I think is we're making progress, but could be probably further emphasized, is that if you access evidence-based treatment, the outcome is generally quite good. Again, not very different from diabetes or hypertension. So you may not have a perfect life, but your life is going to improve in many domains, and medically, in social relationships, job outcomes, quality of life. And then the third aspect that I think it's also again being emphasized more and more, but I would still emphasize it, is that even though there's a personal component in the choice of using drugs, structural aspects are very, very important. And just to bring a trivial example, all of us have an accent. Probably mine is most notable because I grew up in Spain. So we all, and that's not a defect that I have. Depending on where we grow and our circumstances, we develop specific, in this case, patterns of speech or patterns of behavior. And we are determined by that. Yes, we have certain flexibility. We are not completely determined, but we are not also completely free. And so taking into account the experiences that people had of poverty, child abuse, maltreatment, not enough access to education, that is going to shape people's life. And so I think we have to, at the same time, take into account that it's a brain disease, but also, again, not very different from diabetes. If you only have access to junk food, that's going to determine your eating pattern. So those are the three things that I would emphasize if it's possible for journalists, the medical aspect, the hope, if you access evidence-based treatment, and then the social determinants or structural aspects of the disorder.
So Katie, I know you're not exempt to the first question. There are things that happen in the news that have made your job in the news harder. But I want to move the conversation forward and ask you to talk a little bit about the barriers that exist in newsrooms, the barriers that we face when reporting that might contribute to these issues that people like Abby or Laura, Dr. Blanco see in the media that they take in. What are those barriers?
Yeah, and I will say on the first question, bad news reporting and careless news reporting makes the rest of our jobs much harder. It scars populations that don't want to talk to us anymore. But as far as limitations in newsrooms, I think this is probably assumed, but there aren't a lot of people working in media that have experience using drugs, have experience with substance use disorder, or getting through the other side of it. It's just it's not present in our newsrooms. And there are obviously exceptions to that, and you will see when those exceptions are there, people who do have those experiences, the reporting is just out of this world phenomenal because they can relate to that subject in a way that I can't, and I'm not ever going to pretend to be able to. So that's a really big barrier there, and that's a hard thing as a journalist to admit, that you will never know what this person is going through, but you have to try to explain it in a way that other people can somewhat try to understand it. It's like 3 layers to the core, right? And it's never going to be exactly what the experience is, and it's never going to capture all of it. So that's a real barrier there. And to that, part of that is just taking as much time as you can to talk to as many different people as you can about the experience. There are differences in opinion in recovery communities between experts, between people who use drugs, about what the best route is and what the most helpful for them is. And every case is different case to case. And other limitations, journalists, for all of their good in this world, tend to be really stuck with the way of working. That limits sometimes progress that can be made even as society progresses towards like new ideas and might be more open to things. You're working in newsrooms a lot of the time with people who've never done this type of reporting. And when they were doing reporting, especially editors who were older, it was a different world of drugs, kind of, and a different world of recovery. It was pretty much pre-opioid epidemic, pre-drug epidemic, pre-overdose epidemic. And you find yourself, especially me as a young reporter, when I came into this, explaining these really vast and overwhelming issues to people who aren't witnessing it firsthand, who sometimes don't maybe believe what you're telling them is the fact. And you become, in your role as a journalist, and like anyone who follows me on Twitter knows anything about me, my tenet is do no harm in journalism. You become an advocate for the people that you're writing about. And I don't mean that in an unethical way, but it's your job in a newsroom to defend those people and fight with your copy editors and your editors for a language that puts them first and is against these stereotypes and stigmatizing and we talk criminalizing, not using police language when we're talking about this stuff. And that can be hard sometimes when you're like 22 years old and this is your first job, and am I going to get fired for disagreeing with someone? And I've been lucky enough that, I've been in newsrooms. My newsroom is in the heart of the opioid epidemic. We're in Charleston, West Virginia, and empathy, luckily, is not hard to impress here because everyone has been affected by it in some way, personally or secondhand. So, it is more difficult in other places, though, and that's a hard position to put reporters in. So if you are one of these reporters, this is something that can help your editor. Resources like this, when you're trying to talk to people who don't understand and aren't in the position that you are to go out and talk to people and understand it themselves, we need to have things like this that we can turn to that are evidence and in one place that say, this is why we cannot say the junkie and the addict and those types of really demonizing and damaging language for a whole movement that's going to save lives.
Awesome. Thank you so much, Katie. And I also recognize, I hope you don't feel like as the only media member, we're putting all the weight on you, but thank you so much. And that's a really well thought out answer to that question. Carlos, or actually, before we jump into this next question, I want to remind people the Q&A is active and our other team member, Kristen and Ashton, are trying to answer questions through there. So make sure you drop any questions for the panelists in there if there's anything that strikes you when they're talking. And Dr. Blanco, I'd like to start with you for this next one. And what do you think is the best way for journalists to really talk about the different paths that are around recovery while also emphasizing those evidence-based approaches?
Obviously, you have to try to tailor your stories to your public. And so you as journalists, I think, know much better than many of us how to address this variety of audiences. But maybe one way is to, when we think about addiction, I think many people, including myself, often think about opioids or cocaine, but certainly tobacco is the deadliest addiction of all, and in a way it's less stigmatized. And as we all know, first of all, it's very difficult to quit tobacco. People who smoke, the famous quote, the Mark Twain, I think it is very easy to quit tobacco. I've done it many times. Now I do it several times a day. So obviously it's very difficult. And I think people can understand because many people in their families have had relatives or they themselves have smoked, how difficult it is to quit the smoke. And at the same time that there are different ways of quitting smoking. So some people are able to do it on their own, cold turkey. Some people use nicotine replacement therapy. Some people use medication. So there are many ways of doing it. And the same for alcohol. Some people may go to AA. Some people use medication. Some people use psychotherapy. So I think drawing on those analogies of addictions that may be more familiar and to a certain extent less stigmatized than, let's say, opioid use disorder, I think that can help many audiences understand that the same way that for these addictions there are many pathways, the same way At the same time, if you think of opioid use disorder, obviously medication is much more effective in trials than many other approaches, like let's say abstinence-based approaches, no? But I think, I like your question. I think it's important to convey to people that there are many different paths to a common goal.
Thank you, Dr. Blanco. And we'll open that up. Katie, it looks like you got something to say. Go ahead.
Yeah, I don't know if this is how you meant the question, but from a framing the story perspective, find someone to talk to all the avenues. Like I said before, and Dr. Blanco just mentioned, some people, even in recovery, they go toward the 12-step program. As you said, other people really are against the 12-step program, right? But that doesn't mean that it's good or bad. So when you're writing that story, it's not your place to take that stance, but you find someone, maybe if that's what your story is on, who that program worked for, and someone who it didn't, and explain the differences in what their addiction process, recovery process was to getting to the point where it worked. And the person that's reading that, it might not be their case, right? It might not be their circumstance, and they might need to do more of a Suboxone route or a medically assisted treatment route or something. Some people only want to do abstinence, but that doesn't mean that abstinence is the right choice or the only choice available. And be sure to be clear when you're writing that just because you're writing about one instance doesn't mean that it is the right instance. Just because you have one doctor saying, in this case, this worked, there are so many different ways and combined ways of getting into treatment and sticking with it that there's no cure-all, right? And in that, the reporting, being really honest about what the process is. Don't ever focus on relapses. Relapses are a part of recovery. They are a common part of recovery. And if you don't relapse, I hear this all the time from doctors, you're the exception. So be sure that you're clear on the process and know that steps back are not failures of a certain way of going forward in recovery.
Laura, can I ask you, and then we'll open up to the other panelists, but is it responsible for journalists to include, quote unquote, both sides in a story when one side does not have the evidence to back their statements? Are we pointing at certain elements of treatment and harm reduction recommendations by experts that don't necessarily need to be balanced out with public opinion or other perspectives? Can you speak to kind of that both sidesing that journalism often does?
I think if you clearly define who the sides are, this is a lay person, as Katie was just saying, sharing their own experience about what worked for them. So that's one person, and that's wonderful. But it doesn't mean that's going to work for everybody versus, when there have been large clinical trials on medication for opioid use disorder, this is an evidence-based treatment that is overwhelmingly the most effective tool we have to fight the opioid epidemic. Now, does it work for everybody? No, but the overwhelming evidence suggests it will work best for most. But you also may talk to someone who said that didn't work for me, and that's a valid personal opinion, but it's not kind of on a large scale, representing the evidence basis. So I think as long as you identify kind of the side and who they are.
Do any of the other panelists want to jump in on that one? Abby?
Yes, just to kind of echo back to what was being said, I think that in terms of, representing or the representation of especially MOUD and pharmacotherapy as a treatment option, it very much is ensuring that we aren't perpetuating the notion of replacing one substance with another, which is a very common narrative and something that is frequently heard. Oftentimes a lot of the conversations that I have with folks are around I take medication for my mental health. No one's ever shown up one day and been like, well, you've taken this medication for this long, now it's time for you to stop. Why? Because it's effectively helping and treating something that my body needs assistance with. And oftentimes, I think that when we're representing these things, that it's very much an adversarial depiction of 12-step versus one or the other, instead of looking at it as there are a multitude of paths. And I think something especially too that is never addressed, or at least not very frequently addressed, are the number of people that age out of addiction. You have a large number of people that age out. or the number of people that need potentially other needs met, lack of mental health care, lack of housing, lack of food, lack of, stable income. All of those things are factors that can have an impact on someone's propensity to use a substance, their trauma, all of these things. And those things are largely often unaddressed. And I think that partially goes back to the idea that we moralize something instead of looking at it from a clinical perspective.
Yeah, and I'll say is like both sides is my direct answer as a journalist is no. I think it's absolutely irresponsible to equate two sides when, this is like kind of a fresh thing for me because we just got off a year-long bout about syringe service programs. And there's no question in the science that syringe service programs are scientifically based to stop and prevent HIV, hepatitis, and all these other things. And what we saw a lot of here was media that equated to, so you had a doctor, you had 3 or 4 or 5 doctors talking about this. And then you had so-and-so who lives down the road who's worried about crime in their area. And that person's concern isn't invalid. There's definitely a place for neighbors to have concerns about crime and crime that is potentially maybe related to drug use, especially in an area where there are high drug use rates. But if you go and you look at the crime stats for the FBI, we've seen a decrease in crime over the last 4 years. It's irresponsible of a journalist to put that person's opinion in the paper without putting that context that says they might be concerned about it and they might have seen this thing happen yesterday. But across the board, our crime is down. Our violent crime is down. And that's the nuance that's always missing there. You hear a lot of that with recovery houses and how people don't want those placed in their areas because crime goes up wherever those are. There's not ever been a single study that shows an increase in crime around recovery, at least not one that's peer reviewed and that's like real for the situation that we're looking at. You can't study a match for anything, but if you are going to both sides, and I understand the need to put like community concerns and especially when they were like these motifs to a conversation that you can't seem to overcome. Needles everywhere is a big one around us. You need to put the context there that there's no data showing an increase in needles. There's no data showing an increase in crime. There's no data showing what these people's concerns are, but they still may be concerned. And that's what I think we lack is the nuance in that reporting and the responsible and ethical thing. And that's on us as journalists. That's not on the person that we're talking to. It is on us to provide that. And that's where we fail a lot of the time.
Oh, I completely agree, Katie. I mean, as I said, as someone that runs a syringe service program, we know statistically that, syringe service programs normally statistically reduce the amount of syringe litter in a community. They reduce the risk of needle stick injuries to law enforcement and community members. They reduce the rates of new infections of hepatitis C and HIV. They reduce the rate of bacterial infections such as bacterial endocarditis. And it also has larger impacts as well. You see a reduction in, impacts to like your infrastructure. So you don't have damage to sewage. You don't have damage to, like communities, like property. And, in addition to that, people that have access to syringe service programs are 3 to 5 times more likely to enter treatment. Why? Because they have connection, because they have access to, a comprehensive harm reduction program that not only provides them with sterile equipment to make sure that they don't contract a potential deadly disease, but they also have folks that can provide linkage services, and all of these things are statistically shown.
No, go ahead, Katie. Oh, I saw the hand up, sorry. And I do want to echo Carlos's point previously too, that, and one of the designs with the project by focusing on reporting on addiction broadly is that we do hope that the media covers all of the different elements of addiction from tobacco to alcohol and all of the different evidence-based and other approaches. I know today we're focusing a lot on opioid addiction. It is obviously a very pressing issue in our country, and we have a number of awesome opioid experts and a journalist that really focuses on opioid, but I do want the audience to at least know that the resources are tailored to broader issues with addiction, as Carlos pointed out, and improving coverage around even just talking about, the different approaches to tobacco reduction or alcohol use disorder. And so Abby, I did want to hit you with this next question, and it feeds on that two sides thing that we were just talking about. And I appreciate the robust discussion around that. So thank you everybody for that. when this two sides sort of angle is done, and it's the, you know, the person down the street that's having an issue, but it's balanced by a number of experts that are saying it's really helpful. Have you seen some of the direct impacts of that in your community when, you know, an article does include some of those, let's just say non-expert, but equally valid concern voices in the reporting?
Oh, definitely. I mean, you know, because inevitably stories of that nature help to control public narrative. You know, they impact public perception around things like harm reduction, substance use, syringe service programs, just the full scope of these things. And so, you know, when you know, not that like, you know, Mrs. Beavers down the road doesn't have a valid concern, but when we're not accurately stating that while this is her concern, this is what the data shows, you know, then we're inevitably just steering people to one very specific opinion and idea about something. And that can be grossly misinformed. Because inevitably, you know, the internalized, like the community level stigma that is often associated with substance use is something that you hear regurgitated frequently. Just get on social media. You will see it all over the place. You know, every time somebody posts about, you know, why is Narcan free and, you know, like insulin not, you know, but a lot of these things are perpetuated though by stories that don't accurately discuss like what the reality of those things are. So, you know, I do think that when we start talking about two sides, like, you know, what are the two sides that you're representing? You know, I mean, I think that that often has to be the discussion. Like, you know, if you're accurately presenting, like, these are thoughts and ideas that folks may have, but they're incorrect, or they are not the fully informed opinions about what is accurate with these things. You know, that's one thing, but oftentimes that's not how that's represented. It's one community member against another community member. And oftentimes you have no real accurate data that's ever used. And that is when it becomes very terrifying.
Yeah, thank you, Abby. And Laura and Carlos, if you guys could comment on, you know, maybe some experiences you've had with patients that have, you know, reported back and said like, hey, you know, I saw this article, or kind of the general vibe around addiction treatment in my community made it so that it was a little bit more challenging to get in and start my recovery journey.
So I actually really like, sorry.
Go ahead.
What Katie started out saying in the beginning, which was framing the role of media as advocate. And when you're telling a story, you know, telling it from a place of advocacy, I love the sense of that. Now, you know, you guys tell complex stories that may not, they have more than one side, and so that's, you know, a little bit hard to figure out who you're advocating for, and you know, presumably it's the truth, whatever that might be. But I think it's it's incumbent upon all of us to sort of look at how we, you know, look at our own biases in terms of how we view people with substance use disorders, because we all come with those biases, and that is the lens through which we view things. Everybody has that bias. And then sort of widen that lens to look at the whole landscape. Because I used to be afraid to talk to the media because I was afraid that like they would twist what I said, and so this idea of the media being an advocate is a fantastic way. And then I've had some really great experiences, especially with local public radio, and been able to tell what I felt like were very accurate stories, especially about evidence-based treatments. But you know, that's not always the case depending on what the media source is. And so this is a complicated issue, and it's the media's responsibility to represent a full range. So I don't know that there are any easy answers.
So I think that there's maybe two different situations. No, I think that maybe some reporters have an agenda. If somebody has an agenda, they ask you questions. No matter how you answer, I mean, unless you're a very, very skilled lawyer or politician, at the end of the day, they're going to get you to say something that you didn't want to say, and then you're going to regret. No, But I think, again, at least in my experience, I think the majority of journalists, when they interview me, they just want to know. And I mean, understandably, they know less than I do. That's why they interview me, because if they knew more than I do, they wouldn't need to talk to me, right? So I think our job there is to try to explain in, you know, as simple language as possible the different views. Whether you present two sides, I mean, maybe one way to, at least one way I think about it is, how would I present this to a family member, no? And I wouldn't want to hide all the potential opinions to my, let's say, to my mother, my siblings, or my wife. But at the same time, I would not give the same weight to any opinion. So I think the weight of the evidence is important. Maybe an analogy would be, you know, if you want to know what's going to happen tomorrow with the weather, yes, you can present the view of your neighbor, but I would trust much more the weatherman than yes, maybe the guy next door says, well, you know, when there's sun at 7 p.m. and then there's 3 clouds, it always rains in my village. Well, yeah, maybe, but rather, right? I trust much more the models. So I think in medicine is the same. Maybe, yes, your cousin got better from opioid use disorder by drinking tea every night, maybe, but in general, most of the population. So I would present again, yes, there are opinions, people are entitled to opinions, but I also think we have to present, it's not, the two sides have not the same weight. You have to weigh the presentation depending on the evidence on each side. That's the way I think about it.
I want to go ahead, since we've only got about 15 minutes left, and try to get to some of the questions. We've had a lot of questions submitted to us. So Katie, I think maybe the first one might be the most appropriate for you. It seems like there's no coverage of addiction and treatment in our area. What are some of the good starter stories? And then maybe we can ask the other folks to chime in too.
Yeah, first, I would be careful about saying there are no, there's probably some, whether they're good in quality, that is definitely like a dissertation right there. But some starter stories, I mean, that's a hard question, actually. I didn't expect it to be, but it's always good, especially if you're unfamiliar. A good place to start, just call people around you. Recovery houses will often have staff on hand. You know, do a little research on the recovery house, see if they're above board, where they get their funding from, stuff like that. But reach out to them and ask them. Or if you don't have recovery houses, but you have medical experts in your area who cover addiction, reach out to them and ask them, because they're going to know. They talk to these people all the time, kind of like Ashton said in the beginning. Journalists are like we can send people to places, but they definitely have their ear on the ground. And if there isn't a lot of reporting going on, trust me, they're going to have some places where you can dig in. Some warnings on that too, you know, in framing reporting for addiction, especially if you're just starting out on it. And these are mistakes like I made, and I wish that somebody that I love the Reed College of Media, but I wish that I learned this there. I wish that I could have gotten this in J school. The way that you frame your stories, be careful about that and be cognizant. Know that, you know, don't frame recovery as you know, the end all be all of a story, and don't put someone's worth based on their sobriety. That is a really big thing that you have to be careful with. You know, people who are using drugs actively are just as much people as someone who's been in recovery for 15, 20, 30 years. They have just as much potential. They have just as many opportunities if we give them to them. So be careful in that. Make sure that you're not centering all of your stories on recovery, but on also active addiction and the stressors and the issues that come along and trying to get past active addiction and into recovery. Kind of like Abby was talking about, what systems exist around you that are entry points? And if there aren't any entry points, why is that? And how are people going around them? Oftentimes you'll find really dangerous, sometimes ways of trying to get treatment and trying to, and maybe not even treatment, but trying to see what they do is or what they see as their safest bet at that point. Sometimes that's in harm reduction circles too. You'll find people that are cleaning needles in a way that they aren't supposed to be clean and end up injecting blood or bleach. You'll find, because these services don't exist, people are trying to fill them themselves without training. And when you go and you do those stories, remember who should be held accountable for that. It's not the people who are using drugs. They are victims in the system. It is the people who are not giving them the services that they need to be safe and healthy at that time.
Awesome. Thank you, Katie, so much. I will jump back in or to another question, and I really appreciate those thoughts on that, Katie. Somebody asked, what does it mean to age out of addiction? And I thought this would be good for our clinicians on the call, Laura and Carlos, to kind of talk about that as the different processes that and manifestations of addiction, which could be helpful.
Do you want me to start, Laura? Or? Yeah. So I think there's two questions here. One is what is to age out of addiction, and I mean the way I would interpret this is that many people, most people who have an addiction never seek treatment, but as Abby was pointing out, many people eventually stop using drugs or stop being addicted. It's not very well understood why that happens. But it happens, and many people over time, actually, if you look at the time course of disorders, nicotine dependence and alcohol are probably the ones that have the longest time to recovery or to abstinence. But eventually, you know, even people who smoke, if they do not die prematurely, many of them, and again, they do it without treatment. Now, most people don't seek treatment, they stop. So obviously they stop on their own. Some of the things that probably influence those processes have to do with social environment. So when when you're in college, you're much more likely than binge drink than when you're at work and you're 50, right? So the social environment, again, very important. Also impulsivity. When we are younger, we're more impulsive, and also reward. People get more intense reward when they are younger. So some of these things, social processes, our biology, our neurotransmitters, our reward centers. So I think that's the first part, how I would respond to the first part of the question. Then the second part, I think, has to do with the consequences of addiction. And of course, there's going to be, depending on the specific substance, some particular consequences. But I think in general, most addictive disorders, at least most substance use disorders, are going to have some physiological effects. So again, tobacco, I mean, if you think about tobacco, alcohol, they're going to have effects on risk of cancer or liver disease. Opioid use disorder obviously is going to have risk of overdose, risk of injection. But beyond the medical consequences, I think there's a greater appreciation that there are also consequences about housing, stigma, obviously criminalization, and you can go to jail and all the disruptions that would ensue, social relationships, family relationships. So really the consequences of having a substance use disorder are really not only medical, but really spread across a number of dimensions. That's the way I would, or at least the way I think about it. I don't know, Laura, if you see it differently or you.
No, I think that's a great description. I don't know if I have a tremendous amount to add to it, other than if you think of, development and what's happening in adolescence versus adulthood, people sometimes are able to respond to those external forces. Social determinants come into play where it's not sustainable to continue along the sort of progressive path of addiction. One might argue in adolescence, some people get fairly deeply into the progression of their addiction in adolescence. Other people really don't. And so it may have also something to do with where they are in that developmental process, kind of across the lifespan, as well as where they are in the progression of their disease in terms of substance use disorder.
I want to get to a question that was dropped into the chat, and I don't know who on the panel might want to take this one on, so I'm going to throw it out to everybody and see. So we're often taught as journalists to take our cues about how to describe or to refer to someone from our sources themselves, especially around gender identity, which is something that journalism schools are really discussing today. But it can be problematic when we're dealing with people who have substance use issues, and when they describe themselves in those pejorative terms, when they use words like "I'm a junkie" or "I got clean." Do you have advice for how to respect the language that sources use to describe themselves, but without advancing stigma?
Hi, Katie here. Yeah, I think, did Jesse Ray drop that? Yeah, I want to make sure I'm getting the right question. Okay. Yeah, I mean, the way that I go around this, and I think it's going to be different depending on what your style book is and how your copy editors go in your copy. But I mean, if someone says something like that, it's their right to call themselves whatever they do. Put in a quote. If it's in a quote, keep them quoted. You don't change quotes to take out colored language. Someone says, I'm not going to cuss on here, but SHIT, you put it in with asterisks, right? You don't take the word out. So, make sure that you're quoting directly. And then when you're writing, if someone calls themselves a junkie, you can say, Joe has had substance use disorder, has suffered from addiction, has had substance use disorder for 10 years. He calls himself a junkie. Make sure that you're making a distinct difference. That they are saying that and not you. You are not putting your own words onto their colored or lived experience. And in that too, I think there's a common sense line there of what's acceptable and what's not, and what your standards or your newspaper are. On the other side of that, when people say it hatefully, I take it out. I don't put it in there because I don't like to spread hate throughout my reporting. But if it's a public official and they're in a public meeting and they feel entitled to say that language and use it, and this has happened to me several times, they get called out in that same meeting and that's not okay to say, put that in there so people know what kind of people they are, and make sure you color it with better language than that, and don't let that be the running theme throughout. But make sure that you know where that language is coming from, because if it comes with stigma attached to it, and that's it from someone who is making policy decisions, that's really problematic, because that is going to be reflected in their policy decisions. So be honest about who the people are, let people describe themselves, but be very clear in where those descriptions come from you, from them, in a quote, just make it be clear.
I think we have time for just one more. So, which I feel really bad about because we have a lot of really great questions. So I apologize if we didn't get to your question this evening, but this one says from Sydney says, a part of the stigma regarding substance use disorder is the way we stigmatize the medications that people use. So for example, we say things like painkiller rather than pain reliever, using the term addictive medication, which implies that everyone who has taken the drug becomes an addict. So how can we get the media to stop using these pejorative terms? Abby, Laura, Dr. Blanco, anybody have an opinion on that one?
It's kind of funny. I was just editing a flyer that was a promotional flyer for a study that one of our research staff had written, and it used the word painkillers. I was like, what? You can't use that word. But like just increasing the awareness, because I think sometimes we get so used to the language that we don't even realize. I mean, in certain circles, people are functioning where they don't really realize what is stigmatizing and what's not. So increasing that awareness is key, and having someone kind of review it who may not, who may have a different eye for what's stigmatizing can be really helpful.
Anyone else, any other thoughts you'd like to add about that one?
I think, there's always a tension between we want to change the world, but we also have to be patient, no? And so I think what was not stigmatizing 10 years ago, we read it and we find it stigmatizing now. And I think that's a good sign, no? That means that we're making progress. So yeah, I don't have a big advice. I think maybe to be patient. I mean, we don't want to be complacent, but at the same time, we don't want to sort of prosecute everybody who used the wrong word or the word that, I think painkiller is a good example. Maybe not the perfect word, but maybe it's not that tragic, no? And so again, I think it's good that we're making progress and that people with good language skills are refining more and more how we should speak and how we should avoid stigma and how we should avoid internalizing the stigma that others put.
Yeah, and my only thoughts on that too, because this is something that I run into a lot with my editors and my copy editors, is understanding the limits sometimes of journalism in the way that we have to use language that people are going to understand that aren't as versed in the subject as I am, whereas the person that I'm talking to is. And that sometimes puts, like, copy editors, for example, sometimes won't know something that I put in, and then you find yourself like, I've been writing about this for 5 years now, and I still have to say what Narcan is in every story I write, and that understanding, I think I lose it a lot because it's second nature at this point. I can whip these stories out in 20 minutes because I've memorized a lot of this stuff. But that's not the case for the general public that's reading. We read that like MAT, people don't often know what MAT is. You have to spell out medically assisted treatment and say exactly what Suboxone is. And you're never, your editors might get mad at you, but you're never going to be wrong in over explaining something basic. Painkiller, I've probably used that. I cannot say that I haven't and haven't even thought twice about it in a way that, people know what a painkiller is and they might not know what if I say like a specific brand and tablet. And I'm not excusing that at all. And I think, the understanding that we have a lot of progress to be made is good. And we should be pushing for like better use and very basic things too. But if you do see that, I think the best way, reach out to the editors of the program and do it in an educational way, not in a you use this. And that's a little blah, but be like, hey, like, did you know that we don't like this kind of language because of XYZ, and these are the connotations that can come along with it and the damage that does to our work. And they might, I know our paper has done that. We've changed things because of that. So always reach out. But yeah, remember, there's a big learning curve here, and I don't say that to excuse bad behavior, but it just as a realistic point.
Thank you for that, Katie. Jonathan, I'm going to hand over to you to do our thank yous and our sign off. Really quickly, though, I just want to say we had a question about stigmatizing images and video. That is a big to do on our project, is to provide training materials, but also provide images that news outlets can use that reduce that stigma that we see in images a lot. And we had another comment. I think it was maybe Jesse's. We've worked into some of our training materials about when it's appropriate to change the language that somebody is using about themselves and when it isn't, hoping to teach students and other journalists about making choices that can have an impact in our communities. So we see some questions about things that I promise we have thought about and we have coming. And so we hope that you will stick with us as we work on rolling out these resources and materials. And Jonathan is going to tell you more about how you can keep up with us.
Of course. Thank you, Ashton. So yeah, if you could sign up for our newsletter, of course, at reportingonaddiction.org, that's a great way to stay up to date with things. And we'll also follow up with folks that signed up, and we'll add you to our newsletter if you signed up for this event. You can always unsubscribe. Kristen just threw it in the chat there for you. And that's a good way to stay up to date. And I also really want to thank our panelists. I'm going to go in order just in the direction that they're on my screen. Laura, of course, Abby, Carlos, and Caitlin. I think this was an absolute delight to have you all here. I know some have been really instrumental in the creation of the project. Some are new sets of eyes, and it's very encouraging that we are able to have this discussion with such a diverse group of people and come to some understanding about this to really improve reporting and improve journalism from local to national level. And we appreciate everyone's support, and it's just so grateful for everyone to take some time Monday night. So thank you all, and we will follow up here soon, I'm sure, right, Ashton?
Yes.
Yeah, a lot, probably too much. But thank you all so much.
Thank you.